I'm Clare Anderson, and I'm with Chapin Hall at the University of Chicago. And my colleague, my dear colleague, Krista Thomas, is walking around the room giving handouts out. So we thought we would start by just doing a quick scan of the room to know who's here. So let's just do this sort of table by table quickly. So just tell us where you're from. Middle table. Great. Great. Over here. Being here. We've got a couple of extra people joining us. If you could just tell us where you're from and your name.
Emily Horner from Oregon. Kikora Dorsey, Family Programs, Washington State.
It's got a mix of the Children's Bureau, Casey Family Programs, states, and tribes. It's a nice, good group. Hi, come on in, find a seat. We're just getting started. And I've gotten the heads up that we only have 50 minutes instead of a full hour. So we're gonna.
Good thing you got me.
We're gonna go super fast. And I'm going to come over here to the mic to make sure that people can hear me. So we're going to, as I was saying at the beginning, we want to present ideas. We hope these ideas are helpful to you, and we want your feedback on our ideas. So because this tool is in development, and we want to continue to refine it. So we're going to talk a little bit about assessing your tribe, your tribe and your state partnership as you get ready for Family First, as well as using it as a platform to begin planning. So we think of this a little bit as an assessment and a planning tool. And we're going to talk about the domains, components, considerations, guiding questions, and being methodical in how you approach Family First. It is an amazing opportunity. I want to channel both Jerry and Barbara Pryor's energy from this morning in the plenaries about what a wonderful, unbelievable, exciting opportunity this is. It is a once-in-a-generation kind of policy. And as Don Winstead was saying earlier, people are like 5 different stages of understanding and acceptance of the policy. You know, like really excited to being terrified to understanding that this is what we've been looking for a long time in child welfare. So we hope to kind of balance that space in between terror and excited to get you ready, right? Because there's a lot to think about here. And we want to provide you with some structure and a framework to approach it so that it is not so overwhelming and the exciting opportunities that are before us rise to the surface. Anything else you want to say as we get started?
As usual, that was the last point that I was hoping to make. Can you guys hear me without the mic? Is this okay? Is that I think to echo what Claire just said, there is so much information in this law, and it can be really kind of overwhelming in trying to think through all the different domains. And this tool that we're working now to create, hopefully now with your feedback, is to help try to flatten some of that complexity, make it a little more manageable, to think through all the different domains, to come up up with the questions to ask yourself across the process so that you can take it one bite at a time. You know, let's look at the next 10 feet, figure out the questions we got to answer, and then go from there. Because we think there's really no other way to do it.
Terrific. So we want to start with just some lessons learned over the last 5 years, I think, from the waivers as one really big policy opportunity that came down from Congress to us. And having worked with many of the states that have waivers and with working with states in other policy arenas prior to the waiver, one of the things that I heard, I think, Jerry say that I sort of stole my thunder here, which is that a big policy is a tool. It is not a thing in and of itself to implement. You can approach it as one thing to implement, or you can think about it as a tool to further your vision and your direction. And the states and the tribes that can do this thing with an eye toward what do we want different for kids and families? What are the priority outcomes that I want to achieve for them? What is most important? Someone on the very first panel this morning said, you know, my experience with the system when I was trying to have my kids returned was that the system didn't have a philosophy. Does anybody remember that this morning? It was a profound statement. That system didn't have a philosophy. Family First can help you get a philosophy if you don't have one. And if you have one already, it can help you further it. So I would say that that is among the biggest lessons that I've learned and have been learning alongside states and tribes as they have worked to transform their system. And this is a transformative moment for us to grab hold of. Okay. So I think Krista just said what is on this slide, but I will say it a bit again with the picture. To undertake assessment and planning methodically allows you to maximize and leverage what's in Family First. You really want to, and we've chosen those two words very carefully. You want to maximize it. You want to use it to its greatest potential. You heard everybody this morning talking about we want to make sure that it is as flexible as possible when we put out guidance, when we interpret it, to really maximize all the components, but also to leverage it to further your strategic direction, to leverage it to further what's best for kids and families, to use that sort of crowbar of it and to further your transformation, to be methodical and to identify the opportunities and challenges. And we think very close to our heart is CQI. So always think about what are the 10 steps that are in front of us and how do I improve what I know now? How do I go and get the data and evidence to understand how well I'm doing in the implementation of the core components of Family First? And how do I always get a good plan together, make sure that my plan is informed with data and evidence, activate that plan, study that plan, and then see what I'm resulting in the plan, and then act accordingly.
Question.
Yes.
I'm Chapin Hall. I know healthcare. So can you please tell me what CQI stands for?
Yes, continuous quality improvement. Thank you. Come on in, Peter. What you need?
Are you guys using it?
I am using this computer.
That's right. You get by it. Do you want my computer? No, that's fine.
Okay.
I'll come back and get it afterwards.
Okay, thank you. Sorry, Peter. Okay. So this is a screenshot of one of the pages of the tool, the assessment and planning tool, to just give you a sense of how it's organized. And then we're going to walk through this. So there's a lot on one page, and we're going to break it apart for you to make it clearer and simple. So up at the top in this light purple shading is your domain. And in this particular domain, it's the guiding framework, as we've called it, and you'll see how that hangs together with the rest of it. The components are the strategic direction and priority outcomes with specific considerations within each of the components. So the bulleted list. Within that, a set of guiding questions. So think about this from the least complex to the most, or the high level to the granular. Thank you. That's exactly the word I needed. To the granular. So the framework, the domain, the components, and then your guiding questions. Okay? And then we've got a space here for you to add your responses. So we're going to disaggregate all of this and see how it shows up on a page. So we think that there are a certain set of key domains that you need to look at when you are assessing your system for readiness and for planning. Your guiding framework, your practices, your service arrays, and your policy. The data and evidence that you need to collect and to use. Your administrative and fiscal components of your organization. Your change management, and then how you sequence it, and if there are any special considerations that you have for your tribe, for your state, for your jurisdiction. Okay? All right, so we're going to take these one by one. Guiding framework. Well, let me go back for a second. It's worth saying, and I should have said this earlier, so we want to apply these to each of the provisions in the Act. So you could see doing this multiple times because there are multiple provisions. You don't do this once, you do it multiple times, right? The two biggies that we've spent a lot of time talking about already today are what? The prevention and the congregate care provisions. But there are a lot of other provisions. There's kinship navigator, there's meeting the needs of young children. There are a number of provisions within the Act that are worth your time to walk through this process. And I'll tell a very brief little story about why I think that's important. It kind of comes back under the maximize and leverage heading. So when I was at the federal government at ACYF, I was working under the leadership of then Commissioner Brian Samuels, who had a policy agenda about well-being. There is a long history of legislation related to well-being, but not a lot lately. We leveraged 12 words in the reauthorization of the Promoting Safe and Stable Families Act to say, really, Congress still cares a lot about well-being, and let's have a conversation about well-being. Right? We could have blown past that. There were a lot of other words in the reauthorization, but we created an entire platform on something relatively small. So there are things that are going to be really important to you in the Family First Act in your tribe or in your state that may or may not be super important over at this other state, right? But how you choose to leverage it is part of that trick earlier, where it's a tool. It's not a thing unto itself. I'm seeing a lot of head nods. So this making sense? Yeah? Leverage. Okay, so you would apply this to each one, and you'd start with the guiding framework for the provision. What's the guiding framework for this particular provision? When is it required to occur? What's the implementation date? How does it, and I said this earlier, how does it fit into my strategic direction as a leader, into the vision of my department? Where are we trying to go? This act does more to confirm that Congress cares about families than many things in a very long time. And how you leverage that towards your strategic direction, the priority outcomes that you're trying to achieve, is a critical question. For the provision that you're reviewing, who are the target populations? And what outcomes are to be achieved as indicated in the act or that you have established for yourself? And we've got priority outcomes and outcomes to be achieved, because those may or may not be exactly the same thing, and you need to think about both. Practice, service array, and policy. For the provision at hand, does it suggest, or do I think, that there are casework and supervisory practices that will need to be revised, right? Are there assessments that will need to be undertaken with children and families? Of the assessments that I have, are they sufficient? Do they need updating? Do I need new assessments? What about the case plan? Do I need a new case plan or a new section of the case plan? Or does this touch the case plan at all? Or are there opportunities to think about case planning differently with kids and families because of what's here? Service array. Obviously, lots of implications across this entire act about service array, but you want to look at that not only for the two biggies, but you want to look at it for the small ones. Of course, my favorite of all of them, I think, is the provision about meeting the developmental needs of young children, right? You may have some implications there for your service array. And are there any policies, regulations, or rules that need to be updated or revised to respond to Family First? And certainly, as you're thinking about your timeline, you need to think about what your legislative session is and when those kinds of policy changes at the state or tribal level need to be updated. Okay.
I might add to just that point, Claire, it doesn't say it in the bullet itself, but beyond or before perhaps policy, regulatory, and rule changes, you might need actually a state law change. And taking a look at the provision and whether or not you actually need to pass legislation at the state or tribal level to enable your agency to enact a provision. And so that's just maybe even a preceding thing to think about before you can even get to the level of policy or regulatory change.
Data and evidence. Are there federal requirements in the provision under consideration that you're looking at that are required? Do I need to collect new data? Do I have the mechanisms to collect the data? Are there federal reporting requirements that are new or different related to the provision? Do I need to make any changes in my information system in order to capture the information that's required? And are there any particular analyses that I need to do or to conduct, or evaluations as it relates to this provision? And there are a few big ticket ones throughout that need attention, and having them all in one place is important. And then we are big believers, as I said earlier, that approaching this from a continuous quality improvement standpoint is exactly the right way to go. There's language in the Act regarding CQI and evaluation, and having that bumped up against each of the provisions is necessary. Okay. So I'm going to turn it over to my colleague to walk us through one of the handouts and the tool, and have the discussion about the tool in front of you.
So if
All right.
everybody could get
You know what? You do, because they're
I'll do this.
recording. Oh, right.
So if everybody could get this handout, the one-pager that has the two boxes at the top and the bottom, it is the one that looks like the screenshot that Claire showed. One clarification to make, that this is the format that we're using for the sake of the presentation and the exercise today. We recognize that to actually ask and answer and capture the information for all of these questions, we're probably going to need a little more space than this. So this is just for illustrative purposes to try to make it approachable, but the actual format would be one that would allow for the richness and the detail that would be needed to answer all of these questions. So what we're going to do is we're going to divide into two groups for the next, say, 10 minutes or so. And I'm going to arbitrarily and capriciously, as Don said, make this group, these first three tables towards the front, one group, and the two tables in the back, another group. And we'll have the first three tables closest to me focus on the top of the worksheet around case and service planning, and Clare had talked through some of the elements there, and the 2 tables in the back to focus on service array. And you're like, what am I going to focus on? There's a lot in there. To think about one element of the legislation. Maybe you want to focus on the some of the prevention questions. Maybe you want to focus on congregate care or kinship navigators or whatever is burning in your mind and where you think you want to engage in the discussion. To just pick that in your table and practice. Thinking about how you might go about answering these questions and what some of your preliminary responses might be, to think about trying to walk through this methodical process. So we've got case and service planning over here. We've got service array in the back. The specific questions that we'd like you to start thinking about are the ones that are in the blue-gray box. And then to just think it through together with your table mates about what answers you might pose or you might provide to those questions based on the experience in your tribe or jurisdiction. And then more importantly, think about, if you were doing this for real, how you might go about starting to answer some of these questions and what that process might be, and that'll lead us into the first part of our conversation. Does that make sense? Questions? Right. So take 10 minutes and start thinking about how you might answer these questions as it relates to these 2 domains, whichever your assigned domain is within your state or tribe, and do that within your tables. And we will come back in about 10 minutes. Okay, this might be a little less than 10 minutes, but we only have about another 20 minutes in the session. So we're going to pull back from that and start talking a bit about what your experience was like trying to engage in using an assessment tool like this, or starting to structure your thinking in this way. So any brave volunteers to kick us off before we get into the main questions about what were some of the themes that were arising in your conversation? Either initial struggles or things that you found helpful or really confusing? Mm-hmm. 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 No, that makes a lot of sense. And I think that states and tribes and local jurisdictions are at very different places in beginning to understand the legislation and its implications. We work with a number of jurisdictions that are already trying to get out the gate and starting to think about doing an assessment like this, but not having the tools or resources to do so. And others that are still trying to figure out what the heck is in that giant law. And so I think that is the whole point of this conversation. So that's really helpful feedback. Other reactions or thoughts? What might you need to know to be able to inform an assessment like this within your jurisdictions? Mm-hmm. 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 So I'm just going to do a quick reflection for the recording to make sure that it's recorded. I think some of the key points in what you said was, one, the first thing you got to do is take and make an assessment of what your tribe or state agency is already doing, so we can see where there's a need to do something differently, as the first point, as the first place to start. And then two, to be thinking about what are the regulatory or other changes that are going to be needed in order to make these changes, and to figure out what those processes are and what the timeframes are, and whether that's reporting to tribal council or reporting to state legislature, to be thinking about what the timeframes and the protocols are for that, because all that would need to happen before any changes could be made. Is that a fair reflection?
I agree with that, and I think there's even a step before that to an earlier point as well that you made, I think, which is, what is your vision as a group?
Mm-hmm.
Who do you want to serve? Who do you need to be serving? What is your vision for those that you do serve? And really starting there and letting the legislation help form your vision, and then this maybe becomes a little easier.
Mm-hmm.
To start to break it down that way. Does that make sense?
Mm-hmm. Absolutely. I think that's the key, and Claire said this earlier, a big lesson from the whole waiver conversation was, how do you leverage this massive amount of funding flexibility to further the strategic vision for your agency? Yes, indeed, there were discrete evidence-based programs or strategies that states wanted to test, but they also got a tremendous amount of flexibility to reinvest that savings or think about where they wanted to go, and then use it as a lever for a large-scale systems change that includes but goes much beyond a specific practice or assessment or whatever was being specifically tested under that. So I think that's an incredibly important point. What do you think about stakeholders? I mean, this piece of legislation cannot be done with a small group of people. Like, it has tremendous implications across a wide range of stakeholders. When you think about engaging and preparing for Family First, who do you think about that needs to be at the table and engaged in that process? Families, right? Who's most impacted? Are there ways that you think about stakeholders that perhaps aren't traditionally involved in planning or reacting to something like this that we might want to consider engaging in a new and different way? I think families are absolutely an appropriate answer there, but other partners, providers, legal stakeholders, folks that we know that are so implicated by the work that we do, but maybe don't get pulled in as early in the process as maybe would be helpful. Mm-hmm. Yeah. They might need whole new business models. Yep. Yep. Mm-hmm.
So having them at the table for planning is incredibly important.
Right.
I think one of the challenges that Iowa will face is with our judicial partners. Judges, we have some judges who really are used to kind of running the show and think that they know families and are making decisions and ordering things that maybe not the new
Mm-hmm.
philosophy that we're going to
Well, we see that happen in lots of places where the judiciary or one judge makes a set of decisions that may or may not be consistent with where the agency is trying to go. And remember this leverage thing earlier, right? That this provides you with a whole new platform, a brand new reset platform to have a conversation with your judiciary about what the congressional intent is, the direction that Congress is going, Congress's willingness to be engaged on the prevention side, and what the desired outcomes are. It's a whole new opportunity to have that conversation. And you can say, well, we've had that conversation 16 times and it's never gone anywhere. But you have a really huge lever all of a sudden.
Well, I think you want to bring together your tribes, your state, your support improvement project, your GALs, your CASAs, your private foundations, Casey families.
Yep.
Your whole child team, plus somebody said providers, like your community providers. How is this going to impact them, and how could they support families better in this earlier stage of the plan, right?
Right.
And
I think another way to think about is the Children's Bureau partners as we think of, as we think about joint planning and planning for your planning for your CFSP and your APSR, and looking ahead and integrating this with where you're at in your CFSR process or PIP, program improvement planning processes, what are ways that we can bring federal partners to the table to help inform and be resources and trying to sort all of this out?
Also, remember your other, especially as you said providers, remember your other state partners. So especially as a lot of conversation was around substance abuse this morning, there's almost $1 billion or more that is going to substance abuse. And there's been emails from Samson and Krista late in last month of over $900 million going out. And so who can you talk to in those states, in your Medicaid agencies, in your FERSA grantees, and also the IHS in several regions is also involved in informing some of those decisions. So who can you talk to think about how can you get more service providers in those areas that you will then be able to claim things for?
Yep, very nice. Has anybody started to do a more of a formal assessment of readiness for Family First within your state or tribe? Has that been a process we've been able to get to developmentally? Mm-hmm. I don't think anybody was at the planning stages. Right. And I think that. Okay. All right, so I'm going to keep us going to talk through a couple of the other domains. So one of the other domains under consideration is administrative and fiscal. As we were hearing in the sessions this morning, and then if you were in Don Whitstead's section around contracting. Major implications for contractors who are likely freaking out. Are you going to need new contracts? Are you going to need to modify your contracts? Are you going to need to find completely new partners, or are the folks that you've been working with going to have to think about readjusting their business model or their service array in a way that's going to be effective and productive within the Family First paradigm? Also thinking about contracting as procurement. I'm not sure about your systems, but everyone I've ever interacted with, procurement can be a bear, and the timelines for ushering that through. So when you're thinking about the timelines of implementation and when you want to be moving forward on some things, how far back do you have to get the contract set up so that you're going to be able to be ready to go and to be thinking about procurement in addition to the substance? Budgeting and appropriations requests. We heard Ross say this morning, I got my legislature coming back in January, and I got to figure out this budget. What is the future going to look like under Family First, both in terms of opportunities to bring in additional federal funds, maybe where they weren't available before, but also to be thinking about mitigating strategies in case on the congregate care side, if you're going to be experiencing shortfalls because of being ready to move forward in some of the congregate care provisions. But what is the budget that you need to be building? What are the considerations? Where might you need some additional funds, and where are there going to be some opportunities? And to be able to think about that within the context of the timelines of your legislature and when you need to pull that together. Federal plans and reporting. There's a lot of new reporting requirements and CQI requirements that are associated with this legislation. How does that fit into your current processes for creating your child and family services plans, your annual progress and services reports, and the new prevention plan that we now need to be thinking about? Echoing the point from a few minutes ago, engaging your federal partners and other folks that are part of that process in addition to all the stakeholders that were mentioned. Accounting and claiming systems. There's all of this conversation around candidacy. Do we have systems that are set up to be able to capture that? Are you capturing it now? If you're not set up to capture, what needs to be built? When is that going to be built relative to when you're going to want to start determining candidates and maybe claiming under some of the preventive provisions? Or thinking about reorganizing or re-understanding your Title IV reclaiming and what opportunities are there relative to your existing systems and what might need to be built or done differently. 5 minutes. Okay. So change management. Oh, yes.
One question, I don't know how familiar you are with Agent Health Service with the PRC, the Purchase Refer Care.
Not terribly, I'm sorry.
Okay, so it's within the system where if an Indian health facility can't, a higher level of care, they get referred out, and depending what the priority is, the IHS will pay for that bill. My question is that, I'm pretty sure that since age services isn't, I guess, considered priority within our PRC or the Purchase Refer Care. So will there be talks between this agency, because I'm HHS, that's all I know, but will there be talks between like this agency and the Department of Health and Human Service to where they need to start using of that PRC funding so they can start, IHS can start paying for treatment services, for this particular bill or law?
I mean, I think those are the exact right questions. Like, I mean, I don't have the answer for you, but in terms of thinking through the way these different systems talk to one another, what the referral processes are, what the reimbursement processes are, to figure out what that infrastructure is, where things need to change, what might need to be added, and if we need to be doing some education of people that make those decisions so that the systems can be reconfigured. So we have another domain called change management. Arguably, a lot of these things would fall under change management, but we're focusing on these 4. One is workforce capacity and alignment. So you're going to be doing a whole bunch of new stuff. Do you have the right staff? Do you need more staff? Do you need staff with a different set of skill sets that's going to be able to implement the provisions? Do we need to think about supervisory ratios, how they might need to shift so that workers are supported in being able to do work in potentially a different way than they've been doing? Training and doing an assessment of your training curricula. What does pre-service training look like, and might that need to look a little bit different if the system's going to be reconfigured? What about ongoing training opportunity for your existing workforce, and what new or different curricula might be needed or enhanced to be supportive of family first? Of training for resource families, as we're thinking about reconfiguring placement arrays, trying to get more kids out of congregate care placements into family-based placements. What kind of resources and training might our resource families need to be able to effectively serve kids? If we want to disentangle restrictiveness of care with intensity of treatment and provide services to kids when they're living with families, what kind of training and resources might your resource family need? A stakeholder analysis and engagement, this goes back to things we've already been having. What are all the stakeholders that need to be in the table? How are they going to be impacted? Back to the provider conversation. Who might need to be engaged when, as you start to think about the sequencing, and to be really thinking about the stakeholders that are going to be critical partners in the process. And communications, internal and external. There is a lot to understand, and then once we understand it, we have to communicate it to all the people that are going to be impacted. That's both internally within agencies, and what's the strategy going to be for that? Also external partners, what's the communication strategy? What are your existing communication platforms, and can they be leveraged to push out information about Family First, or might you need new communication platforms? And that's a whole element of a change strategy that we often don't have a lot of time and resources to invest in, but is super important for educating stakeholders and bringing folks along in the process. And I think, not just in the interest of time, won't spend too much time here because it came up, but really thinking about sequencing and interdependencies and what are specific things you might want to be thinking about as they relate to your state or jurisdiction or tribe that maybe didn't come up. Like the sequencing, like at the highest level, the prevention relative to the congregate care, knowing that we can't move into the prevention space unless you're ready for the congregate care space, and how the timing might that work. The contracting issues, the training issues, and all those other things that take a long time to get through, and how does that fit in when you're thinking about sequencing your efforts? Sorry, that was a little faster than I had intended. What we're thinking about moving from here to the future and preparing, there's a lot of steps in the process. One, really thinking about what are the stakeholders you want to be including, doing a very, very careful review of the law and then its provisions. Using the tool in its entirety to really think through the different provisions and all these different domains that are within it, and then to be integrating the thinking across those provisions to come up with a more comprehensive implementation plan. That sounded really easy. It's a simple 4-step process. You'll be fine. Nothing to worry about. So let's use our last couple of minutes to talk about these last couple of questions. I know that was a really high overview. We didn't have a lot of time to cover a lot of complex information. But what was your response to that? Like, what do you see as gaps in the domains that we talked about, in the different categories of where we want to be focusing some energy, what's missing there. And if we're going to go from here into a tool that's going to be useful for all of you, what else needs to be thought about? How can we improve it to make it fit your needs?
My question is more of a curiosity. So I might not be getting exactly to what you're asking. I'm curious if you consider the tool sequenced itself, right? Like that you start with guiding framework, then you move to crosswalk of practice, service horizon, policy. So has some of the work already been done in terms of this is your suggestion about how it might be sequenced?
That's a really great question. I mean, I think we thought of that, but not explicitly. You know, like I think we started with guiding framework, right? And what's your strategic direction, your vision, what data do you need? So in that sense, absolutely. I'm not sure if there is that much explicitness across the rest of them. I mean, sequencing and interdependencies is last. I would put it last if asked. Otherwise, I think you might, depending on how you view your system and what you think your needs are, you could mix it up a little bit. But generally speaking, I think it's a relatively good sequential process. But I wouldn't feel like I had to hew to it so tightly that you got constrained.
Mm-hmm. Some tribes that I work with, they would only be implementing one requirement, or they may only work with the state to implement that requirement with their children. But one tribe may do all of the above. So how can you, because it's really overwhelming to a tribe that doesn't want to do all of it.
I mean, that's a great question, and frankly, something that we've been trying to think about the best way to handle, which is why it's written right now kind of generically and abstract because there's so many different provisions and we want it to be flexible, but it's both and. And so my advice or guidance would be in that circumstance, if we have a tribe that's going to focus on, I'm making this up, the kinship navigator provision as the place of focus, then to walk through the full tool, specifically thinking about and only thinking about the kinship navigator element or what's relevant to the change efforts that they're trying to do. For a state, got a lot to do. I can envision this tool having many different teams and work groups that are working. You have your prevention team that's working a lot of that, and congregate care folks that are doing their own set of things, and some of the other ones, your early childhood folks. And then you could adapt. Then you could use it to answer the questions and plan for the things that you are charged with asking and answering. Trying to come up with a tool that was unique to each like that just seemed like that was too much. And we thought the place to start was, what are all the big buckets that you don't want to forget? Because it's easy to forget about some of this stuff. You could do all this and not go back and look at your training curricula. Or you can do all this and not actually have a communication strategy. Or something like that, to try to at least get the big picture things that you want to think about, knowing what you know about implementation, knowing what we know about systems change, knowing what we know about data use and CQI. Let's get all the things on the table and then figure out how we want to apply them relative to whatever provision you might be engaged in at the particular moment. And then at the end, think about how all that fits together when you're in a state that's trying to do it all. But really good question. What would you guys need to have? What would make a tool useful for you? What would give you the structure and guidance that would be helpful without being overwhelming and seem then, as a consequence, not terribly helpful? Mm-hmm.
Briefly, for Iowa, for all of us in Iowa, we were just talking about how we have all of these thoughts, and we need to get it down on paper. We need to see it. So this is really perfect timing for us.
Mm-hmm.
So thank you for that. But I think to give feedback, I think we have to start playing with it to figure that out.
We'd love to get your feedback when you start playing with it.
Mm-hmm.
Very much so.
Thank you.
From everybody.
we about at time?
Right on time.
And we are right on time. So great, we did it.
Thank you very much.
Thank you very much for your participation.